Hello, everyone. Good afternoon. Thank you so much for joining us today for this important discussion on how stakeholders across campus can come together to really support student athlete mental health. I'm Farah Gilani with Mantra Health, and I'll be moderating the panel today. We'll start with a moderated discussion followed by a Q&A session. So if you have questions throughout the webinar, please do submit them in the Q&A box, which you'll see an icon for at the bottom of your screen. We'll collect your questions and get to as many as we can towards the end of the webinar today. Our discussion today will be recorded, so if you'd like to rewatch or share with a friend, we'll be sure to email it out. I'd like to give a really warm welcome to our panelists today. We're so excited to have the three of you here. Thank you for joining. We have Ari Miller, who's a licensed mental health therapist and currently serves as the Assistant Director of Student Athlete Mental Health and Performance at Johns Hopkins University. Ari has been in the student athlete space for a long time and was previously Assistant Director of Athletics for Sports Psychology and Counseling at Vermont. In his current role, Ari works within the athletics department directly with student athletes. So welcome, Ari. We also have Dr. Jennifer Whitney, who's a licensed mental health counselor and currently serves as the Counseling Center Director at UNC Greensboro, where she's been for 15 years. Jennifer was previously at Ohio State University in a similar role. And she works as a director very closely with the athletics department at her campus to support student referrals. And then we have Dr. Tim Silvestri, who is a performance psychologist, and he's also currently the Director of Counseling Services at Muhlenberg College. Tim is actually a highly competitive athlete himself and works very closely with college athletes, both at his campus and in the community. So thank you all for being here. You know, I want to start by just acknowledging that everyone here today has an intention to support student athletes and has a responsibility and a role to play in ensuring that athletes get the right type of care and that it's accessible to them. But, you know, often compared to the general student population, student athletes don't often seek help for their mental health needs. And when they do, they may face numerous barriers to care. So I'd love to start with you, Ari. How do we change this, and who's responsible for the mental health of college athletes?
Well, it's a really important question, and I think we're making strides in the right direction. And positions like mine and universities and colleges around the country are adding to staff and enhancing resources. So I think that's a really good step. Is we're starting to, as a cohesive unit, university-wide, understand that this is a challenge for the student athlete population to get access to services, to feel comfortable asking for services, and then once they engage with them, feeling like it's worth their time or they're getting something out of it. So I think we're definitely moving in the right direction, but it really is the responsibility of everyone who will come into contact with a student athlete. It's having an understanding that the identity of a student athlete, the way that their timeline leads into their career, might be different from other students and may carry with it other challenges and other stressors, other areas of increased or intensified anxiety that might not be on the plate of another student. So it's understanding the population and having a community approach where everyone on campus that interacts with student athletes is willing to work and be creative and understand that we may need to continue to evolve in our services and how we present them to student athletes.
Yeah. Oh, Farah, you're on mute.
Oh, thanks, Jennifer. Ari, could you share a little bit about towards the end, you said how we evolve on those services. Could you share what that means?
Sure. Well, I think, we're seeing that, the latest NCAA data that came out in the spring it's still pretty clear that student athletes are struggling with a whole host of mental health challenges. And I think we have to, in essence, meet them where they're at and understand that their schedules, the types of stressors that they're under don't allow for maybe the same level of, time commitment or even willingness to engage with services because they feel so overwhelmed already with what's on their plate. So I think, like our position here at Johns Hopkins, I'm embedded. I am located in the athletic facility as one example. It's just limiting those barriers, making it as easy as possible to schedule with me, become familiar with me in terms of seeing me at games, seeing me at practices. So it doesn't feel like they're engaging with a service that they don't understand, but it's a familiar face. It's someone that they've seen around. I think also destigmatizing asking for help and vulnerability in a population that hasn't necessarily been there is really important, with the language that we use and how inclusive we are with the types of services we offer and how we're talking about them with student athletes. So I think that's sort of how I think about it, that we can both practically make changes and make things easier and more accessible for student athletes, and then big picture, we can be really intentional with how we talk about mental health and mental performance, and how our coaches are talking about it, how our administrators are talking about it, and using the types of language and speaking about it in a way that feels like this is something that we want everyone to engage with when they feel like they need it, or maybe even when they don't, just to get some exposure to it and get comfortable articulating their feelings and asking for help.
Yeah, that's really important. Jennifer, you were going to add, as the counseling center director, what's your perspective on this?
Yeah, thanks so much, Farah. I was just going to underscore what Ari had shared earlier. It really is, when you ask that question about who is responsible for the mental health of college athletes, really it is, as Ari said, all of us. And so it is about increasing the capacity of the community at large to meet the mental health needs of our students, particularly, as Ari pointed out, a group of students like student athletes that have the barriers to care, i.e. time, i.e. stigma, et cetera, that Ari mentioned. And so whether that is, and it should include faculty, it should include, as Ari mentioned, folks that are in athletics, athletic trainers, coaches, it really is up to each and every one of us. And so that might for a campus look like mandating mental health first aid, or a suicide gatekeeper training, adding on, right, then what is specific to student athletes and that culture that they bring, and what that might look like, or how that might show up. So again, it is about increasing the capacity of the community at large, right? Ari is one person. I'm going to talk later about, we have a part-time person. We know, based on that, ACHA data, we will far outstrip that capacity if we only look at Ari as the solution or being responsible.
It's a great point. We can't solve this problem individually. We have to work together and across departments. So in talking about the services, Tim, I'd love to hear from you on what kinds of mental health offerings need to even be made available to student athletes in particular. Does it look different than a general student? And more specifically, like from your experience, what kinds of mental health offerings do you offer on your campus?
Yeah, and I think it doesn't look similar, different to other students. But one thing that I try to do when I work with coaches and folks around campus is to outline a little bit about, what is offered, what can you seek out a quote performance or sports psychologist for. And I think one of the ways that I easily do this, and it's a kind of false continuum, if you will, one I created, I guess, but is to try to divide it into, there is the kind of typical therapy, the therapy stuff that you would imagine you would go to see a therapist for and what it would feel like. And then there's the other side of the house, which is much more performance based, and I call it like basically learning how to execute. So I tell athletes and other students a lot, which is if it was as easy as telling yourself to do something and then you would do it every time, there wouldn't be such a thing as performance psychology. So executing is often a more difficult task than we make it out to be on a human level. And so I think one way that I increase help-seeking behavior among the athletes, athletic groups I've worked with, is to try to say, you might come to me or any of the therapists in the counseling center for therapy, but you also might seek me out simply to learn how to execute better. And to me, that's so critical. Part of that on a mental health perspective is athletes who are outcome focused, they're going to experience much more shame, judgment, panic, hopelessness, helplessness, versus athletes that are much more process oriented. They let the outcome show up when they may, but they're really focused on process. They feel much more self-compassion. calm, and more determined. And so that's an example of a more performance-based framework that I can put into athletes to help not only increase or elevate their performance, but if their performance is going better and they're able to execute more, their mental health is going to be better as well, right? And they go hand in hand. So I think that's one way to increase help-seeking behavior and to allow athletes an access point and allow coaches not just to refer athletes to me when they're deeply struggling. There's a lot of steps before that I would have rather had the referral. And I think opening it up to that performance side of the house really elicits some of that.
And how do you teach coaches when to refer, right? So that way you're not getting the student when they're really struggling.
Yeah, I think by introducing those two concepts as one, and the other is I always say to coaches, you bring me in for one session, that would be like teaching a soccer team on one occasion how to shoot the ball correctly, right? Like, so there's a lot to cover, and more the more they interact with me, the more they know there's a lot to cover on the performance side. But I do try to, importantly, I think it's important, it's good for coaches to know what does it look like when we're we have to really step in. When someone's really starting to neglect their responsibilities, they're starting to withdraw. There are those points when students are really hitting the wall, and it's time for somebody, anybody, all of us to step in. I liken it to shaking if you're cold versus hypothermia and you pass out. If someone's passed out, we have to intervene. If someone's shaking, we want to intervene and begin to access help-seeking behavior, right? And to differentiate that psychologically for coaches, I think is important.
Ari, what are your thoughts on that? You work with student athletes full time and have also spoken about the performance piece of your work.
Well, I think in terms of interacting with coaches and sort of opening the door, I always try to have as many team meetings as I can, especially to start seasons, where I sort of lay the groundwork for what my services are, what a student athlete could possibly talk about in a meeting with me. And I try to keep it broad, where some student athletes want to come and just sort of talk for 30 minutes about what the services might look like. And I educate coaches on what, that there's no, any reason to reach out for me is a good one, right? I'm happy to have a conversation with anybody who wants to talk more about what help-seeking behaviors might look like for them. Coaches have been fantastic here at Johns Hopkins in terms of understanding the value of this kind of work and referring students, welcoming me into team meetings and allowing for that dialogue, and even some consultation with coaching and coaching staffs around what's the best way to refer, how do we get people on your schedule, so that it takes everybody in the community to be bought in or to understand the value for sure. I think in terms of sort of differentiating between, mental health services and some performance coaching or mental performance, there's certainly some instances where they blend together, where it's a mixture of the two. And then there are some student athletes that are more comfortable with the mental performance side of things, and that is their foot in the door to then realize that talking in a one-on-one setting or articulating things in a certain way might be more comfortable for them than they thought. So I look at the performance coaching both as a way to enhance mental skills, to allow for cognitive development in different ways, but also as a foot in the door for other kinds of services when they might need it. So I think there's a lot to be gained just for any professional having a student come talk to them, and just getting more exposure to what this type of work looks like, even if the content is very specific to self-confidence or breathing techniques or self-talk in that first initial interaction.
Yeah, it sounds like it's a great way to really introduce a student athlete who may be really unfamiliar with mental health care to what this means and what those skills are, by offering that performance piece. And it sounds like if a student is really struggling, has waited too long, it's impacting their functioning, then perhaps more therapeutic techniques might be appropriate at that time. Could you both share, or either of you, how one might decide to kind of move between the two, or even thinking about the right type of provider, right? Is there a specific type of provider that's fit to do the therapy versus the performance, and how do you distinguish between the two?
I mean, I would say the provider would just have to be comfortable with both sides of the house, you know, for one. And I do train my staff on that. And there's some easy stuff to do when, for example, if you're going to execute heading into any block, I don't care if it's in the weight room or you're going for a study session, always name a priority first. What's your name one priority first, knock that off, right? And that's something we can all do. And that's kind of the performance side of the house, right? And then the therapy side. So, you know, I don't know if there's types of providers per se, but I do think sometimes demographics matter, sometimes they don't. My staff is a highly diverse staff, many identity groups represented. And so, you know, they are available to all of our students, and students seek them out, but they're also around me all day. So they get a lot of this performance training bolstered into their normal therapy stuff.
Yeah, I would agree with everything that Tim just said. And I think also talking about the differences, or maybe where those two areas blend together, just opens up even more opportunity to educate around what services look like. There have been certain situations where that conversation leads to a referral to a private therapist who maybe has a sports background, or we sort of identify, here are the options for different types of work that we can do. And I try to set the stage, you know, very early with when I talk with coaches or when I'm meeting with teams around, here are the different kinds of services, here's what you might work on. And then that leads to, you know, people finding the right support services. So I think it's getting ahead of it and trying to, you know, when appropriate, direct students to the support systems that they might need. I say this to all student athletes I work with: you have the option to work with me. Right? If I'm not the right fit for you, or if there's something else, if there's another expert on campus that has an area of training that I don't have, I'm happy to be the conduit to get you to that, to what you need. So I'm very open to those conversations. And I think that's a good place to start with student athletes, so they can feel like they have there's some empowerment there, and there's some understanding of, I'm going to find the right services for me. And once they find that tends to be really helpful for them.
Yeah, that important piece of really creating that pathway for them to get to the right person at the right time is key. Jennifer, as a counseling center director, what's your role in that, and how do you work with the athletics department at UNC Greensboro?
Yeah, thanks, Farah. I was going to underscore real quick what Ari said about, you know, I'm an option, right? I usually use the metaphor of trying on shoes. I'll tell folks, you know, I wear a 7.5, and running shoes, I might wear an 8.5, right? You try it on, you walk around, does it give you blisters? Because I think particularly with a population that has the barriers to care, if they believe it's all or nothing, it's this one person that either helps or doesn't, that can just create more barriers. And so being able to tell folks, yeah, it's okay if this shoe doesn't feel comfortable, you don't have to wear it, we can try a different one. As far as, you know, thinking about counseling center connecting or liaising with the athletic department, at UNC Greensboro, I would call us very lucky at the present in that we actually have a part-time sports psychologist for our student athletes that lives in athletics. However, that wasn't always the case. And so prior to this part-time position, I had served as the liaison specifically, and I still do, but the liaison between the counseling center and our athletics department. And so really thinking about, you know, what that liaison relationship meant, it was that athletics had a person, a specific point of contact in the counseling center. And so whether it was a coach, whether it was the, you know, director, somebody from training, right, they could reach out and connect with me to brainstorm, to think about what do they need, how can we be supportive. And then certainly, you know, thinking about really helping to train the student support services within athletics. There was a lot of collaboration that went in. That's an arm of athletics that really has taken a lot of responsibility for mental health, but then also really working closely with our training staff, right? Because again, they work so closely with their students and develop relationships in which they might be able to say, hey, here's a referral resource, or here's a service that you need. And so I would meet with different groups at least one time a semester to provide training around the services that were offered, how they could access services, and then of course always engaging in that outreach programming that Ari talked about before, going to the teams and introducing yourself as somebody who is hopefully approachable and likable and you can seek services with. I think that's a really important thing to just say. It's not this scary thing, the counseling center across the way. It's actually hopefully accessible and approachable. But then, as I mentioned before, about 5 years ago, athletics partnered with our Department of Kinesiology to hire a sports psychologist that does provide more what Ari's talking about. Is this person is within athletics and does the team support and then some individual services. And of course, as a part-time person, the demand outstrips the capacity. And so now the liaising that happens, and not to say that anybody from athletics can't reach out and call, but just as a communication stream, that person and myself really connect around, okay, how can we support you? If your athletes, for example, are looking for a particular demographic or a particular service, the groups and workshops we offer, we can help channel that person or that referral system straight to the counseling center. I think it's also really important to have a presence, even if you do have some folks who live in athletics like Ari or this person I'm mentioning, to have a presence, right? Because you're going to have athletes that for one reason or another don't want to seek services in the athletics department. And there's some anonymity or there's some safety in going outside of that community. And if you just leave it up to, the Aries, right? I mean, that goes back to our original question of it is all of us, right? Now, the one thing that I would say, if I could go back and create my perfect world, my preference would be that the person that we currently have within athletics was a counseling center staff that was embedded. I think, and there are pros and cons to every decision. So, but really what I would say a pro would be in that situation is an embedded position would connect the provider and therefore the student athletes to the full scope of services in a more, I would say, free-flowing manner, right? In a more fluid manner. So for example, thinking about ways in which counseling and psychological services is integrated into the larger campus and student affairs, thinking about a shared electronic medical record, right? So some of those things that maybe would make referral or resource sharing a little bit more streamlined. Again, it's not the only way. It would just be my, if I controlled the world.
And what would be the benefits of having some of those shared pieces, like even having the shared electronic health records and having someone embedded? Where do you see the impact of that?
Yeah, so I think earlier in the fact that we were talking about it's never going to be just one provider or one person that is what is, solving all of these problems. So for example, a shared EHR, if the person is in a group and in individual, if the person comes in on same day services, right, that shared electronic health record allows for that collaboration, that consistency of care, that continuity of care, and really helps, to kind of connect those dots.
Yeah.
Yeah, so it's just one less barrier, right? So when we talk about the barriers to care, I think it's one less barrier. And of course, people can pick up the phone, but that can also be a barrier. So
Right.
yeah, it is a both and.
And it's a great point for collaboration too, right? Like if we're truly going to collaborate, then those are the pieces, it sounds like, that you believe can really influence good collaboration. The other piece I wanted to follow up with you on, Jennifer, is you mentioned you have a part-time person that's, in the athletics department. I was going to say, is it enough? But you already answered that, it's not enough. So how are you able to meet the demands then if, beyond this part-time provider, it sounds like some students do trickle into the counseling center and see some of your general staff. How's that working? And is that still enough as you prioritize, other college students?
Yeah, well, I think really that just takes us back to our original question, right? I think if you look at mental health in the landscape at, writ large, if you look at higher ed and mental health concerns, and then even outside of higher ed, right? The capacity is never going to meet the demand. And that's true with athletics, and that's true with the general student population. And so it is about going upriver, as Tim talked about before, right? Giving somebody a coat when they're shaking and not just waiting to intervene when they're hypothermic. And so, as I mentioned when we started this conversation, how do we build up the capacity of the community at large? How do we engage in early intervention and then prevention and education, right? And I think that is a model that is a systems model, and it's not just that intervention space, right? And then I think you also have to add on, what does maintenance look like, right? After Tim has done all this excellent intervention, Ari's done all this intervention, how do we maintain those gains, or, give them the boosters that they need so that they continue to move forward? And again, that's not just a one person, that is a system that is holistic about all the stages of change and all of the different phases of everywhere from, prevention all the way to the maintenance.
Yeah, and to
Tim,
jump in,
I was
to
going to
jump
say,
in
what's
real
your
quick.
experience been like?
Only because I'm the small counseling center, right?
Yeah.
We have a campus of 1750, and so we don't have an embedded counselor or anything like that. It comes down to me, the director, yet wearing another hat. But one thing I would say that just to keep in mind, sometimes I refer students that request me because I'm the performance guy and the coach referred them to me. I refer those folks to some of our therapists in-house because they actually can do sometimes a better job. It's hard for me sometimes, and I've seen the opposite, but I'll say in a second. But it's hard for me personally sometimes to not jump on the performance pieces that I'm seeing, because I see the impact that their poor approach to performance is impacting their mental health. And yet when I refer them to one of my colleagues and they just do therapy, they don't know the performance side of the house, I see a much better outcome for that athlete. So just because they're an athlete and there's performance issues doesn't mean they might not benefit more from therapy. And I've seen the opposite too. Embedded counselors in a athletic program, they so gravitate towards counseling, they never really sometimes venture into the performance side of it. And I'm thinking, wow, there's some low-hanging fruit there. So it's partly of personal preference, but I do think it's important to kind of manage that access point with the athletic department, no matter how small or big you are. And it's amazing how hard I work at trying to build those relationships with coaches when I'm giving away services to them, right? So it does take a lot on our point. And one last thing I would say, especially to you small centers, but big centers, you have the same utilization rate problem we have a very high utilization rate, above 30% of the entire campus in any given year. So my plug to everyone would be digitize as much as you can. Digitize your learning. Let people access it whenever they want to. Stop relying on people in the room. Do it in a way that you don't have to be in the room as much as you can. And until we get to that day, we're really going to be hard pressed to have the impact and move the needle on campus that we want to. And that goes back to one of the people wrote a question about NCAA best practices. If we can't digitize them and get us out of the room and get the same service out there, or an alternate service out there than a person in the room, how are we really going to move the needle?
Tim, could you share, with the audience, like just what things should they consider when even exploring the idea of digitizing, like additional support or extra support?
Yeah, so if you have a simple, and we all have our little go-to mantras and such like that, it could be therapy, it could be performance, but whatever you find I tell my therapist, when you hear yourself say something really smart or cool, write it down at the end of the session and think about throwing that on a 3 to 10 minute video and then making it accessible to people, right? The more and more people who can access that. And you just slowly over time build up a library of these little smart things you tend to say over and over again. You're saying them over and over again, it's probably a good one. So put it on a Zoom video, record it, and send it out to people as best you can.
So I have to ask now, what's your mantra that you record and send out to everyone?
You ask any of my students and they'll say, oh, he has literally over 1,000. But I'll give you an easy one that I use all the time with athletes. Gains, like progress gains are like cats. They show up when they want. And so worry about the process you're using to get those gains. Don't worry about the gains, because gains are like cats. They show up when they want.
I love it. Thank you. Ari, I'd love to hear from you. We're talking about all these different kind of models of care, and then even like thinking about exploring options outside of the campus. But a lot of athletic programs want to hire on-staff mental health professionals, or they just want to add more staff members to better support their athletes. So as a clinician working within athletics, what are the benefits to doing that? And then are there any downfalls?
Yeah, so I've had the opportunity now to work in an embedded role at 2 different universities. I've had a chance to sort of interact with coaches and administrators at different levels and sort of hear their ideology behind why they wanted an embedded clinician or a mental health professional and sort of what they envisioned happening. I think because the areas, the field of psychology and mental health and athletics are not 2 areas that have, in the past really interacted a lot. There's not a ton of overlap there if you look a long enough timeline. So I think initially, and a lot of leaders in the athletic space have articulated to me, we just need somebody in here who can get us going in the right direction, right? We want someone who can sort of advise us on best practices, work with coaches, work with student athletes, and then it's sort of on that person to figure out what works for this community. What I found is that you have to be a bit nimble and sort of learn about that athletics community first and foremost. What do these student athletes need? What are their main stressors? How can I fit my services into the bigger picture of the university? And as Jennifer and Tim have both said, there's probably going to be more student athletes wanting your time than there is time. So it's being able to be creative and to figure out how can I engage with other services either on campus or in the private sector in terms of psychiatry, psychology, mental health counseling, clinical social work, when it feels like a student athlete needs that level of care that I can't provide. I don't have the bandwidth to meet with people weekly. We have close to in the range of 650, 700 student athletes. That's a difficult ratio if I was trying to fit everybody in just working with me. So
Yeah.
I think that's sort of how I think about it ideologically, is that because athletic departments have functioned for so long without a mental health professional, and they're realizing that it is an essential piece, that it's sort of we're in the beginning phases of what this would look like. In 5 or 10 years, we may see a totally different landscape, but positions like this one and my previous one were a good first step in just familiarizing athletics personnel, coaches, the current student athlete population with somebody who is training in this realm.
And so, Ari, if a student is experiencing more severe mental health conditions, where do you refer them for therapy or psychiatry? What's your go-to there?
So I always, as any professional, would I sort of classify crisis and emergency in a totally different column. We educate coaches and student athletes around what are the on-campus services for crisis or for self-harm, and we sort of talk about that separately. But in terms of the services I provide and when I would think about helping them refer out, is I'll provide brief therapy services. If somebody has a mental health challenge they want to start working on, and usually after the average is probably 4 to 5 sessions, and then we'll sort of reevaluate. Where are we at? Does this feel like enough support? Do you feel like you have some tools and you've talked through what you need to, and you're feeling like we could meet every 3rd week and that would be reasonable for you? Or based on either what the student athlete has to say or what I'm feeling, that there more intervention is needed here. And usually when that happens, they either work into the case management system we have in our counseling center, or if they're comfortable just with our relationship, I will help them with sometimes some help from student outreach and support around helping them find a private therapist. So I have built a small database of licensed professionals in Maryland that have a background in sports and athletics, and have referred to, there's some wonderful professionals that have been willing to take on new clients. So there's been some, that's taken some time to lay the groundwork, but that's been somewhat successful. But there's more need than we have access to. So it's sort of a game of trying to figure out, how do we service everybody? How do we give people the appropriate care when we know, and Jennifer said this multiple times, and there's just so much need right now that it's I don't try to bite off more than I can chew. I try to be realistic about what one person is capable of, and then use other resources to do the best that we can to provide help for everybody.
I think a lot of campuses are trying to build that database, as you mentioned, and sometimes the pitfall to that, or the barrier, is sometimes just that students can't afford the private therapy or don't have insurance. How often do you run into that, and how do you overcome those obstacles?
Well, I think that there's a piece of education that goes into that I think the mental health system at large, or how we all interact with it, is not common knowledge to most 18-year-olds, right? I think the idea of finding a therapist, how to pay for therapy, what does my insurance look like, that is not something that most college students are well equipped with. So part of I think my role, in any role, is to educate student athletes or any young people that come into my office around, well, here are your options, right? Here's how this system works in the state that we're currently in. But there are moments where we hit roadblocks, where we're like, well, we've figured out who's in network and who's out of network, and none of these people work with me, and I can't afford it. And then that's when we sort of go into directions of talking with student outreach and support, and trying to figure out creative ways to help with copays, or to find any sort of services that would fit within what this student athlete can afford, or what their insurance plan allows for. But it is not an easy process at times, and it becomes arduous and time consuming, which, when you're in that moment, in a very taxing, stressful moment, the last thing that you want to do is logistically be looking through like all of these things that you need to figure out before you can get help. When you need help, you need help. So I think that's the obstacle, is how can we make this as easy as possible for people that maybe don't have the energy or capacity to spend 2 weeks on the phone with an insurance company.
Right.
I was just going to add real quick, Ari, sorry.
Yeah.
Farah, I was just going to add, I think this is a great space to tap into the donor base. I think one of the gifts of the pandemic is it has shined a light on the mental health needs of the community at large, right, of the nation. But I think there's a lot of energy and potentially dollars behind mental health right now. And so can you, on your university, establish some sort of grant program where students can come and get a micro grant for off-campus services, right? So you can bridge that, and it doesn't have to be, as Ari said, okay, now we have to go back to the drawing board and figure out, and it takes 2 to 3 to 4 weeks, and by then you've moved well past shivering and into hypothermia.
That's a great point. I mean, do either of you or any of you have suggestions for where some of our audience members may go to seek out some of these donor opportunities or grants?
Yeah, I think, every institution has a fundraising arm, right? And so connecting with that fundraising arm and letting them know that that might be a priority of yours.
Mm-hmm.
And so when your fundraisers are having conversations with alums, with donors, et cetera, this can kind of be in their back pocket, right? Because the fundraising arm of the house is always looking what the donor, the potential donor's passion is. And if they can tap into a passion around mental health, they can, as the fundraiser, right, have this to say, oh, well, we have a great opportunity. Would you be willing to endow or participate in, creating this funding stream, this grant stream for our students?
That's great. Yeah.
Oh, sorry. Yeah. I would just like to add that I think that certainly on most, if not all, college campuses, this is a topic of conversation at all levels. So it is something that people want to talk openly about and see what they can do to help the community at large or specific populations. So as clinicians, as people in these roles, to be proactive, to talk to development people, to talk to fundraising offices, and just say, here are my needs, here are the things that we're working on. I think most people, if not all, that I've interacted with over the years, when we have those discussions, are there with open ears and really want to help. And I think it's a really noble cause, but in a lot of ways. So I think it's not a hard conversation to have.
That's really helpful. And I think it requires, as you both said, individuals to kind of get out of their comfort box, out of their office, to go and talk to some of these stakeholders, to seek out those resources. I wanted us to now talk a little bit about the collaboration, right? Because Tim and Jennifer, you both spoke about your relationship with athletics, being in the counseling center. Ari, what's your relationship like with the counseling center, given you're on the other end, you're in the athletics department? How do you liaise with the counseling center at Hopkins?
So the nature of this role is that I'm sort of equal parts interacting with athletics and the counseling center. So I have a direct connection to both. I attend the most weekly staff meetings at the counseling center, and will interact pretty regularly with other clinicians, whether it be a referral for a specific challenge, or just to be parts of small groups and brainstorm ideas. So I try to, even though I'm physically located elsewhere, I try to, even if it's by Zoom, connect with counseling center personnel and be part of the group meetings. I sort of am giving information to either side. I think that's an important part of these roles, where I will relay things to athletics that I hear about going on in the counseling center world and student health and well-being, and vice versa. I can sort of bridge the gap there, education gap there, and talk things through. There are some moments where that works fluidly, and there are others, especially when you're starting a brand new position that's never been done before, as this one was starting it last year. There's a lot of bumps, and you have to have a lot of conversations around, how does this work? We've never done this before. What's the procedure here? How should this go? So it's actually been a really wonderful opportunity for me here to sort of build that from scratch and see what those processes need to look like for both offices to interact in an efficient way. And still a work in progress, but I think we've made some really great strides here in the first little over a year.
Tim and Jennifer, I'd love to get your thoughts, because, a lot of times we hear athletics departments and counseling centers are siloed. How do we align them and build a more collaborative relationship?
Yeah, one other silo that exists a lot is the public-private sector, right? So, Mantra has the therapist across the street model that they're offering now, and that's a great private sector kind of initiative that would bring services on the campus, stuff like that. So we should keep that in mind, and I think our students would use more and more services if they were more and more aware of them. So there's some low-hanging fruit there, but the silos between athletics and counseling, I think counseling has long we've become, as a field, so clinically oriented with these diagnostic words, depression, anxiety. We've kind of lost words like loneliness. We've lost words like sadness. And a mentor of mine, Ian Berkey, former director at Lehigh, would always say, bring those words back into the conversation. Don't let people just talk about depression and anxiety. Make them talk about, I'm talking athletic directors, presidents of colleges.
Yeah.
Get them back talking about loneliness and sadness and stress, right? Because the more we silo ourselves with those words, the more siloed we are, and then we're frustrated. So I think we can de-silo in some of the frameworks we use. And then, yeah, I'll stop there. Jennifer, you probably have some good stuff too.
Well, goodness, I guess you all can judge whether it's good stuff, but certainly it is the relationship building, right? And I think so much of the work that we do, if it is clinical, is behind closed doors, right? And it is one-on-one or small groups, et cetera. And so as capacity, as demand outstrips capacity, it gets harder and harder to get out of our offices. But kind of, as Tim is saying, remembering, right, kind of what is that community psychology look like? How do we engage with the community at large? Because as important as it is to have that individual clinical therapy moment and practice and service, it is equally important that we are getting out of our offices and talking about loneliness and sadness and services and destigmatization. That is all part of our mission as well. Or as Ari said earlier, part of our mission is educating about, how to access these services, what does copay and coinsurance mean, right? I'm some 40-ish years old and I'm still like, I don't know, why am I paying this copay? Didn't I already pay, right? So it's a tough system. And I think there's lots to do in the room and there's lots to do outside of the room. And I just really, Tim, love and appreciate that you're talking about, in general, it's not just our field, but the over pathologization, over pathologizing, right? Like everything is depression, everything is anxiety, and losing the conversation around loneliness. I just really loved that. So thank you.
Are there best practices in, improving the referral pathway to the on-campus counseling center? What do you recommend? And, all three of you feel free to chime in here.
I would say let's stop some of the incessant focus on stigma, destigmatization. It's important. I'm not minimizing it, but increase help-seeking behaviors. And the more conversations, therapists are also experts on change. Therapists are also experts on how to execute behavioral behaviors that you're seeking to now implement. And so the more we can kind of show people that we're developmental experts in colleges, we're change experts, we're behavioral execution experts, right? I think the more we can kind of swing some of that and move the needle on our entire campus.
Jennifer, are any thoughts on that, specifically about the referral pathways?
Yeah, on our campus, and you hear folks say, like, if you've seen one counseling center, you've seen one counseling center. If you've seen one institution of higher ed, you've seen one institution of higher ed. So you really have to figure out what it looks like at your campus, right? And so for us, it is what I spoke about earlier of being able to pick up the phone and directly between the embedded person and myself have that connection, right? As opposed to okay, call the main line, but then the student may or may not say the right thing to get to the right person, right? And so just breaking down that barrier to do a little bit of hand holding, which, folks may or may not agree with, but for us, it's been a barrier reduction to do that more directly.
That's great to hear.
I think, and something that is sort of slowly happening here, is that we are leaning more into an embedded model of having more positions like mine in other areas of campus where there's higher need. I think that, increases the comfort level, as I said before, with the person and makes it perhaps less scary to ask for help. So I think that that's an important step. But I also think that, thinking creatively around what does a support system look like? What does preventative support look like? And are there ways to have more informal conversation options, more drop-in hours, more things that aren't, sometimes student athletes will do nothing and then they'll go right into therapy, which can be great, but can we create other systems of support that are maybe, less, 0 to 100 and catch challenging behaviors or things early and get people into the system that way by building up trust in the system through a less formal process of interaction.
That's great. I mean, this has been such a wonderful discussion. We've gone through a lot of really important segments. So I really want to thank all three of you for your time. We do have a question from the audience. Tim, you might have answered this briefly, but the question was about the NCAA mental health best practices, and there's been little in terms of regulating the university's adherence to those practices. So whose responsibility is it to ensure universities are meeting the needs of their student athletes? Ari, do you want to take a stab at that one? They're asking, is it athletics? Is it NCAA? Is it college counseling centers? Who's responsible for that?
Well, I think that, whenever a large governing body will make a statement about, level of services, it's important, but I think that they're working with big data as they should, and they're making decisions based on large numbers. And we can learn some things from that data, but it also doesn't necessarily mean that every single thing in that is specifically correct for your community. So I think it needs to be a collaborative process of leaders and stakeholders and decision makers around, okay, let's talk first of all about what does this student athlete population need. The population, as Jennifer alluded to, like things work differently at a lot of different places. So I think understanding your own system and what might be most effective is really, really important. And then surveying your student athletes as well and asking them, what are they most feeling like they need? What are the biggest challenges that they're facing? And having some of that data as well to then inform decisions, I think makes a lot of sense. I would never say it's just one department's responsibility. I don't think that's really fair.
Yeah.
I think it has to be a collaborative effort, because this can be such a nuanced way of giving care to people. It needs to work for the community it's in, and it's different than seeing any other type of support system in a lot of ways. It's not like seeing a primary care doctor. Your foot hurts, you go talk to the doctor, they look at your foot, they take an x-ray, they tell you what's going on with your foot. This is not necessarily, that's not the process here. So I think the front end conversations around how does this work structurally, with all parts of, whether it be athletic directors, counseling center directors, other student support offices, athletic training staffs, team physicians. And I've been really, I've seen that happen here in real time. And I think that's helped this work, is that everybody has the opportunity to give input and talk through how it might be possible.
Thank you.
If I had my parting shot, I know we're basically out of time. It would be, and this could be the NCAA, this could be any of the other discussions we've had, which is there's a notion that adversity creates growth, but that's not the full story. Adversity that where someone, because of adversity, they obtain knowledge, then they grow. So the knowledge is the mediating variable. It's the causal variable there, not necessarily adversity, because adversity can kill us, right? So the question is, like with those best practices and all of that, if we start thinking about this is basically knowledge, and how do we disseminate this knowledge to make our students more informed on how to do certain things, I think it opens up a brand new conversation that we're hungry for and maybe haven't had yet, rather than looking at it as therapy. Therapy also is knowledge dissemination. It might be personal knowledge, whatever. But so, we can use these bigger, broader frameworks. And I think there's so many good creative answers and juice within them. That would be my parting shot.
That's great. And I think we may have time for just one quick follow-up question before we end here, because I know you all have meetings to get to. But Daniel here posted a question in the chat that I thought was really interesting. He's asking about whether you would recommend a specific person in the counseling center as a designated athletics liaison. And if so, would you recommend certain training for that person to better understand common challenges faced by student athletes versus regular students?
Yeah, I think I'll just take a stab at that. I'm interested in what Tim and Ari say, but the reason I ended up as the liaison here when I arrived was that I used to work in student athlete support services at Ohio State. And so there was knowledge and background and familiarity in understanding what student athletes experienced, right? So that builds a language, that builds a trust in that I can speak eloquently or fluently about what is happening in that world. And so I think automatically that relationship building happens more quickly. Trust is engendered more quickly. And I do think, as Ari, I think, mentioned at the very top of the hour, understanding what the demands are. These are student athletes. We call them student athletes for a reason. They are students and they are athletes, and those are two full-time jobs. And so really understanding what those demands are and understanding what performance and what it means around scholarships and et cetera. So I do think it does take some extra training, and identifying someone does help, I think, make the pathway for communication clearer. So yes, I would say yes to all of those things.
Great. Anything you guys would like to add, Ari or Tim?
Tim already gave his parting comment.
All right. Well, I want to thank the audience for joining us today. If we didn't get to your question, I think there was one or two left. We will follow up with you over email and try to answer your questions. So thank you so much for joining. And to the three of you, thank you for your time and for this discussion and for your input. It's been a pleasure speaking with you today.
Thanks for inviting me.